This is your prostate. This is an organ that sits just below your bladder. So we're looking at it from the side here. Let's now take a look at it head on. So as you can see here, the prostate surrounds the tube through which your urine flows out of. We call this tube the urethra. Now the prostate is around the size of a walnut, and as we get older, typically above the age of 50, the size of the prostate enlarges. Now this becomes a problem when the prostate gets so large that it actually pushes into the urine tube and can result in symptoms such as difficulty in passing urine. So in situations like this, when the prostate gets so enlarged that it can squeeze onto the tube, the urethra, we call this condition of enlarged prostate benign prostatic hyperplasia, also known as BPH. In today's video, I'm going to take you through everything that you need to know about this condition. Let's dive straight in. Some of the difficulties that we see with an enlarged prostate when it comes to passing urine include a noticeably slow stream of urine, also the feeling of an incomplete emptying after you've had a wee. Also got terminal dribbling, which is basically when you continue to leak urine after you finish using the toilet. Also, you might have an increased need to get up at night several times to use the toilet. Now, it's important to attend for a review by your doctor if you have some of these symptoms. This assessment will usually consist of a few questions to get a baseline understanding of your symptoms, therefore allowing the doctor to appreciate the impact that these symptoms are having on you. So following this, the prostate is then usually examined by a rectal examination, and this allows the doctor to further reassure you and also rules out an abnormal prostate or any signs of prostate cancer. A blood test known as the PSA test will also likely be arranged following your assessment by the doctor. Now this test allows us, and it's one of the many tools that we have to rule out a serious diagnosis such as prostate cancer. Now, like a lot of things in life, the PSA test is not a perfect test, and a lot of this can cause it to be falsely elevated. So these will include if you had a current urine infection that can cause the levels of the PSA test to be raised. Also, if you had any vigorous exercise within 48 hours of the test, and also if you had any activities resulting in ejaculation within 48 hours of the test. These are all things that could actually affect the PSA levels and cause them to be falsely elevated. So your doctor can talk you through the process if you did have a raised test and take it from there. So we've had the examination by the doctor, and also we've had the all clear with a blood test. So we've all come to the conclusion that the cause of your symptoms are due to an enlarged prostate. So what are the next steps? Well, we have certain medicines that are available to us to control your symptoms. A very common medication that is used is one called Tamsulosin. Now the way that this medication works is that it essentially relaxes the muscles here. As you can see, this then allows the urine to flow a lot easier. As well as relaxing the muscles around our bladder, Tamsulosin can also affect the blood vessels in our body and relax them as well, which is why one common side effect of this medication is to lower the blood pressure. Another medication that can be prescribed is also known as finasteride, which basically shrinks the prostate. It does this by blocking the production of a male hormone that causes the prostate to enlarge. Now, because finasteride has this effect on male hormones, one possible side effect that can affect some users could be a reduction in sex drive and sexual performance. Now, if neither of the medications we've discussed so far, to Tamsulosin or finasteride, if neither of them are working or are suitable, then we can always move on to a surgical procedure to then manage these symptoms. So that brings us to the end of today's video, in which I've taken you through what you need to know about an enlarged prostate. I hope you've got a bit more clarity about this condition. Now, as always, if you found it helpful, don't forget to leave a like and subscribe Also, make sure you check out some of the other videos that we have on this channel. Until the next time, I'll see you soon.